Hi everyone, welcome back to my YouTube channel, and today we are going to talk about chronic pulpitis. So let's start topic with introduction. Chronic pulpitis is long-standing inflammation of dental pulp that is characterized by slow progression and low-grade symptoms. Unlike acute pulpitis, which is severe and painful, chronic pulpitis often presents with mild discomfort or intermittent pain. If left untreated, it may progress to irreversible pulpitis or pulp necrosis. Chronic pulpitis is more common in adults and is frequently associated with deep carious lesion or restorative procedures. Definitions of chronic pulpitis. Chronic pulpitis is defined as a prolonged, mild to moderate inflammation of dental pulp in which the tissue response is dominated by fibrosis and chronic inflammatory cells, and it is often without acute pain. Etiology of chronic pulpitis. Chronic pulpitis usually result from long-term irritation or infection. Common causes include deep dental caries, that are slowly progressive caries that allow bacterial toxin to enter the pulp over time. Second etiology is repeated dental procedure, that is multiple restoration or minor trauma to the pulp that can cause chronic pulpitis. Third cause can be microleakage, as chronic bacterial ingress from defective restoration can predispose to chronic pulpitis. Fourth cause is might be mild mechanical irritation, that is occlusal trauma, attrition, or minor fractures. Next cause may be chemical irritation, as long-term exposure to low-grade irritants such as acids, foods, or restorative material can cause chronic pulpitis. Pathophysiology of chronic pulpitis. Chronic irritation stimulates persistent inflammatory response. In this, fibroblasts proliferate, leading to fibrosis of pulp tissue. There are chronic inflammatory cells like lymphocytes, plasma cells, and macrophages that replace normal pulp cells. There is gradual calcification or pulp stone formation that may occur. In this, blood flow is usually maintained so pulp remains partially vital. Clinical features of chronic pulpitis. First is pain. That characteristics include mild, dull, and intermittent discomfort. Pain often occurs in response to hot or cold stimuli. It is usually not spontaneous pain, and pain may worsen during chewing or when occlusal forces are applied. Second feature is tooth appearance. In this, tooth may appear discolored in long-standing cases. Deep caries, a large restoration are often present in these teeth. There are no swelling typically observed unless periapical involvement occurs. Third feature is response to pulp test. In thermal test, there is mild or delayed response. In electric pulp test may be normal or slightly reduced response. In percussion, this is usually non-tender unless secondary periapical inflammation develops. Radiographic features of chronic pulpitis. There is usually normal in early stages. It may show deep carious lesion that is approaching pulp. Pulp chamber calcification may be present there. Pulp stone in long-standing cases are present. There are no periapical delinquency unless pulp necrosis occur. Histopathological features of chronic pulpitis. In this, pulp show chronic inflammatory cell infiltration like lymphocytes, plasma cells, and macrophages. Fibrosis of pulp tissue is common. Odontoblast layer may be partially intact or atrophic. Calcification such as pulp stone may be present in this case. There is minimal edema or vascular congestion compared to acute pulpitis. Types of chronic pulpitis. First is chronic hyperplastic pulpitis, that is also called as pulp polyp. In this, there is granulation tissue that protrudes from the pulp chamber into a carious tooth. It usually occurs in young permanent teeth with white pulp canals. Second type of chronic pulpitis is chronic fibrous pulpitis. In this, fibrous tissue predominates and pulp tissue is firm and inflammation is mild. It is typically seen in older patients with slowly progressing caries. Differential diagnosis of chronic pulpitis. First is reversible pulpitis, that is pain and that is brief and stimulus dependent. Second differential diagnosis is irreversible pulpitis. In that, pain is severe, spontaneous, and lingering. A third differential diagnosis is periapical tissue disease, that is, but there is redness to percussion in that case, and swelling is more pronounced. Management of chronic pulpitis. First we do is removal of irritant, that is to excavate caries and restore tooth to prevent further irritation. Second we can do is vital pulp therapy if pulp is partially vital. It may include pulp capping or pulpotomy that may be considered in selected cases. Third we can do is root canal therapy. It is indicated if pulp is irreversibly inflamed or necrotic in parts. Fourth we can do is follow up, that is to monitor tooth for symptoms, pulp vitality and radiographic changes. Prognosis of chronic pulpitis. It is good if treated early with removal of irritant and restoration. Prognosis is guarded if pulp is partially necrotic or secondary infection occurs. Chronic pulpitis may remain asymptomatic for years but can eventually lead to irreversible pulpitis or periapical disease if untreated. Clinical significance of chronic pulpitis. Chronic pulpitis often presents with subtle or mild symptoms, making early detection challenging. Regular dental checkups and radiographs help in identifying and managing chronic pain inflammation before progression. Understanding chronic pulpitis helps in deciding conservative versus endodontic treatment. Conclusion of this lecture video. Chronic pulpitis is long-standing mild inflammation of dental pulp that may remain asymptomatic or cause intermittent discomfort. Histologically, fibrosis and chronic inflammatory infiltration predominate. Timely diagnosis and removal of causative factors allow pulp preservation, otherwise it may progress to irreversible pulpitis or necrosis, requiring root canal therapy. And this was all about chronic pulpitis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.